Hi, I'm Regina. I'm going to be your nurse today. Patient privacy, hand hygiene. Can I get a name and date of birth?
Anastasia Bear, 04/16/2004.
All right, and do you have any allergies I need to be aware of?
No.
All right, perfect. So today we're going to be doing a head-to-toe assessment, and so before the provider comes and sees you, I'm just going to be checking all of your general systems, just making sure everything's good to go, noting anything abnormal. All right, do you have any questions for me?
No.
Perfect. Should only take about 10 to 15 minutes. Thank you for your time. And so we're going to start just with some simple questions. So can you tell me what the date is?
That is Thursday, November 14th.
Mm-hmm. And can you tell me where we are?
We're in the skills lab.
Mm-hmm. And can you tell me who the president is?
Joe Biden.
All right, so patient is alert and oriented ×4. Just from here I can see hearing appears adequate. I don't have to raise my voice. Speech is clear, not slurred. Do you use any hearing assistance?
No.
No. Do you wear glasses or contacts?
I have both.
All right, and are you wearing contacts right now?
Yeah.
Okay, can you read my name badge?
Regina B, BSN, student, School of Nursing.
Perfect. All right, and just your general appearance. You can see hygiene appears good, patient appears in good spirits, posture is upright, no obvious deformities noted, no lines, tubes, or drains. Are you in any pain today?
No.
No? All right, perfect. And let me see. So I'm going to have you just grab my arms. Okay, pull me towards you. Push me away. All right, stick out your feet. Push down. Push towards you. All right, so strength is equal and intact in all 4 extremities. You can close your eyes. Where am I touching you?
Left arm. Right arm. Right leg. Left leg.
All right, you can open your eyes. Sensation is intact and equal in all 4 extremities. Can you give me a big smile? All right, and then puff out your cheeks. Okay, perfect. And what would you say is your mood today?
Pretty good.
Pretty good. All right, patient is in good spirits. All right, and then I'm just going to take a look at your head. I'm just going to inspect it first. Okay. Let me see. Hair is clean. No dentitions, no excoriation, no lesions noted, no infestations. I'm just going to feel it real quick. Right, head is normal cephalic, atraumatic. Perfect. And I'm just going to look at your eyes. Let's see. Conjunctiva is pink and moist in bilateral eyes. Sclera is white in bilateral eyes. Okay. Okay. And if you can just follow my pen. Okay. Okay, pupils are equal and round, reactive to light and accommodation. Great. And then I'm just going to check your ears. Alright, no redness or drainage noted in bilateral ears. Patient does have several piercings above. Just going to take a look at your nose if you'll tilt back for me. Right, no nasal deviation, no obstructions or occlusions. Can you cover one nostril and breathe without the other? Okay, and then to the other side. Alright, bilateral nares are patent. You can open your mouth for me. Right, good dentition, no cavities. Oral mucosa is pink and moist. Tongue is midline. Great, and just, I'm going to look at your overall skin on your face and ears. Also your neck line here and chest. Alright, no lesions, no papules, no redness. Color is appropriate to ethnicity. Skin is warm and dry to touch. Great. And let me see. So now I'm just going to listen to some of your heart sounds. So I'm going to palpate your carotid artery. All right, pulses are equal in strength bilaterally to carotid arteries, no bounding pulse. I'm also just going to take a listen. All right, no bruits or thrills. And then can you lean your head back and look to your right? Okay. Look to your left. Right, no jugular vein distension noted. And then I'm going to palpate your pulses on your upper and lower extremities. You can hold out your arms for me. right. Brachial pulses are equal in strength bilaterally. Radial pulses are equal in strength bilaterally. And pedal pulses are equal in strength bilaterally. And I'm also going to check your capillary refill. All right, brisk capillary refill, less than 2 seconds in bilateral upper extremities. Okay, and brisk capillary refills in bilateral lower extremities, less than 2 seconds. Just gonna do some hand hygiene. Okay, and now I'm gonna listen to your heart sounds. Actually, you know what? Let me just double check the skin while I was already looking at it on your upper and lower extremities. Alright, color is appropriate for ethnicity, no redness, no lesions, no papules noted on bilateral upper and lower extremities. Okay, and now I'm going to listen to your heart sounds. Alright, regular rate and rhythm in all the 4 heart sound pieces that I've listened to. No murmurs, no gallops, no rubs noted, S1 and S2 sounds heard. Okay, and now I'm gonna just check your respiratory system. So just from what I've seen during this exam, breathing appears, chest expansion appears symmetrical, no increased work of breathing, appears to be a regular rate. Let's see. Okay, and no cough noted on exam. Okay, and I'm just gonna listen to your breath sounds. Just take some deep breaths for me. Alright, so no crackles, wheezes, rhonchi, rales, or diminished breath sounds heard anteriorly. Now I'm going to check your medial. I'm going to check your breath sounds medially. If you'll raise your right arms for me. Just take some more deep breaths. Alright, no crackles, wheezes, rales, rhonchi, or diminished breath sounds heard medially. And I'm just going to check your posterior breath sounds. Just keep on taking deep breaths. Alright, no crackles, wheezes, rales, or rhonchi, or diminished breath sounds heard posteriorly. Everything sounds really great. And then next we're going to move on to your genitourinary system. So how often would you say that you have bowel movements?
Like once or twice a day.
Once or twice a day. And did you have a bowel movement today?
Yeah.
Okay, and was it like normal color, consistency?
Yeah.
Alright, perfect. And then your urine, how many times do you urinate a day?
Probably like 4 or 5.
Alright, and when was the last time that you urinated?
Like an hour ago.
An hour ago, okay. And was it normal color, odor,
Yeah.
consistency? Alright, perfect. And I'm just going to have you lay back and I'm going to check out your abdomen. Alright, you can pull your shirt up for me. Alright, perfect. Okay, just going to check out the skin first. Alright, so no redness, no lesions, no pulsations, no obvious hernia noted. Color is appropriate for ethnicity, warm and dry to touch. Okay, it appears flat, non-distended. Okay, and now I'm just going to auscultate your abdominal sounds, your bowel sounds. active bowel sounds heard in all 4 quadrants. Alright, and then I'm just gonna palpate. Tell me if there's any tenderness. Did any of that hurt? Okay, abdomen was soft, non-tender, no rebound or guarding. I'm just gonna percuss. Equal percussions in all 4 quadrants. No abnormally deep or hollow sounds. Right, if you want to cover yourself back up and sit up for me. Right, and I'm just going to go over your musculoskeletal. If you could take your chin and just touch it to your chest. Right, and then look up at the ceiling. Okay, turn to the right, to the left. Right, full range of motion in the neck, no rigidity. Okay, and if you could just lift your arms up and then lean over and touch your toes. Alright, full range of motion in the back. And then I'm just going to take your arm. Alright, full passive range of motion without practice in the bilateral upper extremities. And I'm just going to check the legs. Full passive range of motion without practice in the bilateral lower extremities, hand hygiene. I think the last thing we're going to do is I'm going to have you stand up for me. I'm going to have you walk over there. Right, and then walk back. Alright, so gait is steady and even, no limping noted. Alright, and I believe that concludes our head-to-toe assessment. Do you have any questions for me?
No.
Alright, perfect. Thank you so much for your time. I'm going to go let the provider know that you're ready to be seen. Thank you. And hygiene.